Hey everybody, we're really glad that you are looking at what mental health resources exist for your employees, starting to think about or continuing to think about what this could look like within your own workplace. And we know this conversation is constantly evolving. We know no two workplaces are exactly alike, but we also know there are a lot of really good resources out there to help you navigate that journey. And you never kind of have to build the wheel and build the car on your own. And I think that's a little bit about what this conversation is like today, is a way for us to just help get you started. And so as an introduction, my name is Mike Thibideau. I'm president and CEO of Invest Hamilton County. We're the county's economic development corporation for Hamilton County. And really our goal is that everybody in our community finds economic vitality, prosperity, and we make our community a great place to work, live, and thrive. And a lot of what that entails for us is supporting the mental health and well-being of our employed population and our unemployed population. Really, everybody in the community needs to have access to mental health resources, because this will be one of the labor market differentiators of the 21st century, is how communities handle this issue. And businesses are a key part of handling that. And you can see on this webpage plenty of other resources that we have to help address that. But for today, we're joined by one of my favorite people, one of my favorite places, NFP, who, as a benefits advisor, helps people navigate these journeys. And so, Paul, I'll let you introduce yourself a little bit, and then we'll roll through some stuff.
Yeah, thanks, Mike. So Paul Ashley, I serve as a vice president and consultant or advisor at NFP in the Indianapolis office. I'm also a resident of Hamilton County, so the mission, vision, and values of what you're pulling off are important to me as a resident, right? I live there, I have raising 5 kids there, and my wife lives and works in Hamilton County, so I'm on board with what you're working to do in our community. It's an important mission.
Man, if you're raising 5 kids, you probably have to talk about mental health a lot.
There's a lot of emotional well-being in our house.
Right,
sure.
That's good. So, you talk about this issue a lot,
I do.
This challenge a lot. How kind of did that start? How's it going? What are some of, just how's the journey been, and where do you see it going?
Yeah, I think you have to go back to this sort of accidentally intentional moment that existed in October of 2019, so pre-pandemic. And World Mental Health Day is someday in October. I couldn't tell you what day it is, mid-ish October. And the algorithm of LinkedIn hit me, and I started seeing these messages. And so I went ahead and I posted on LinkedIn on World Mental Health Day about my own personal journey with mental health, which for me started back at the age of 17, where I was diagnosed with depression, major depressive disorder. And I have journeyed with depression my entire adult life. Now I'm in my late 40s. And so that's all I've known, right, is to interact and live with depression. What's funny is when I tell people about that, they're like, what? You're so much fun to be around. You're interactive, you're hilarious, you're the joy of the life of the party. And I'm like, here's what's crazy. That's true, and the fact that I have a diagnosis of depression are true at the same time. Those both can coexist, right? So at any rate, I posted this on LinkedIn, and I got a lot of good, positive feedback. You're always a little nervous about being vulnerable in the public space.
Yeah.
There's a stigma, although thank goodness the stigma has started to wane a little bit.
Absolutely.
There's a stigma with it, and I got a lot of great feedback. One of the things that came out of it was the State of Indiana Chamber, who you're in partnership with, the State of Indiana Chamber approached me and said, would you write a personal point of view article for the Biz Voice magazine? And I said, sure, no problem. So I started writing that late December, early January of 2020. And then we finished it, and it went to go publish, and guess when it published? Late February, early March of 2020, which
Wow.
is right when the pandemic started to just become very obvious in public.
Yeah.
And we all had this shared acute moment of what felt like mental illness. We had withdrawal and depression from everybody shrinking into their homes and not being in social contact. We had anxiety of the unknown. And so the pandemic was awful, but what it sparked was leaders collectively talking about mental health and emotional well-being in the workplace in a way that we never had.
Yeah.
So it's a benefit that it happened. I wish the pandemic had never happened, but this is something good that's come out of it. And so every time I talk to leaders, business leaders, nonprofit leaders, people leaders, all of them are talking about what you mentioned in your intro, which is that dealing with mental health in a productive, positive way, and recognizing that all of us have emotional well-being, whether we have a diagnosis or not, is a business imperative for the future.
Yeah. I think that the leading with vulnerability part of the conversation is really key. So, And I really appreciate you sharing about your own journey. I remember I was working at the chamber when that article came out. I remember reading it. And that job there was the first one where I was ever very public about the fact that I'm in recovery from substance use disorder myself. And like, it's funny because like I'm a huge kind of like nerdy guy who lives in Carmel. Like I joke that all it looks like I used to do was go to kindergarten. And then all of a sudden, like, I was an adult man.
Had a beard.
Yeah, right. Yeah, it just like happened. And so, but the journey's filled with, diverse stories of trauma and things like that, but also, breaking down those assumptions that everybody is just okay kind of on the outside and that we need to keep those things in.
Yeah.
And I remember getting those calls during the pandemic from employers and leaders who were just saying, what do I do? And my first question then would always be, where have you struggled and given yourself grace lately? And they tell me a story and I'd be like,
that's where you start.
Like, that's where you start, Yeah,
and I always tell leaders that their ability to use their own platform and be appropriately vulnerable to what's right for their culture and where they're at in their own personal journey, I would never ask a leader to stretch beyond a point of comfort.
Sure.
If you're not ready to write an article about your mental health journey, don't.
Right.
Just because I did it doesn't mean you should do it. And just because you are talking about your ongoing recovery from addiction, doesn't mean that everybody who is in that spot should talk about it.
Absolutely.
But wherever you're at in your journey, to the level that is appropriate for the culture you work in and healthy for your own journey, is a no-brainer good place to start, because it teaches others in the organization that it's okay to not be okay.
So what are you seeing from you guys work a lot with benefits, you work a lot with culture. What are you seeing as kind of some of those most creative or innovative things that you have businesses doing in your network?
I think a huge evolution that's happened in the last 3 to 4 years is the comfort level that we as consumers have and providers have with digital health, virtual health, telehealth.
Yeah.
And if you think about, Hamilton County has some parts of it that are a little more rural as we go north.
Yeah.
And some of those cities and towns up there don't have access in their hometown to high quality mental health providers. Well, the great news is you don't have to get in the car and drive to another part of Hamilton County or Indianapolis or anywhere else. You have access to licensed mental health counselors, likely through your health plan, through the telehealth app that's in there. And so making sure employers have a health plan that has that, and then also doing a great job branding and discussing it with their workforce to let them know it's available, has really helped bridge that rural-urban divide of access to care. So that's there. And we need to make sure that we're helping people take advantage of telehealth and virtual healthcare. And that's both mental health for sure, but also acute healthcare needs.
Yeah.
And chronic disease management, that's all in there.
Are employers breaking down kind of that stigma related to the telehealth aspect in any unique ways that you've seen?
Probably the most unique thing is that they're saying, listen, it's so much more cost effective for our plan to have this happen. If you use the telehealth, instead of a copay or a cost of X, it's gonna be X minus 20, 30%.
Oh, okay.
So they're gonna be incentives because it's just the cost of doing business that way. There aren't bricks and mortar. The healthcare community passes on at a less expensive cost, so the employer then, within their plans, can do it less expensively. So that's certainly I don't know if innovation is the right word, but becoming more comfortable and acceptable inside healthcare delivery, that employers are taking advantage of that. And really what they're doing to be innovative is innovative branding and marketing. So often employers make great boardroom decisions around their benefits and other perks, but they absolutely fail to brand and market it in a way that's effective internally. Well, you're wasting a ton of cachet and resource. You should definitely, if you're gonna make a great boardroom decision and invest in benefits, you should probably also pause and think about how are we gonna roll this out internally?
Yeah.
How are we gonna drip campaign? What different modes of communication, not just email. Email's great, but what about text? Text is great. What about a postcard to the home with a QR code? It has to be multi-dimensional in terms of how we're rolling out these messages.
I think out of that like active versus passive engagement in your employees' lives, not from telling them every single day what they should and shouldn't do, but making sure that it's more than just in orientation, you tell them about an EAP, it's very active. And what I see even with the telehealth aspect has been, all the time people say, oh, well, I called the EAP, for my anxiety, for my depression, for et cetera. And they gave me a list of phone numbers and I had to call 50 of them.
Yeah.
To mostly get told that 48 of them weren't accepting any new patients.
Yeah, and that's been a huge challenge. the evolution of EAPs in the last 4 or 5 years, which has also become more digitized, which is a good thing.
Yeah.
And it's basically EAPs, which stand for Employee Assistance Programs, for those folks that don't know what the heck an EAP is. It's basically a free resource to your employees. I mean, it costs money, but it's free to the employee that says whatever you're dealing with. It doesn't have to be a mental health diagnosis. It's just the struggles of life.
Yeah.
It could be, oh my gosh, I realized I have a 3-year-old kid and I need to start saving for college. How do I even start? EAPs are there for that. They're also there for, hey, I have some self-harm concerns. I'm not sure what I should be doing.
Yeah.
And so EAPs have become more digital, not just a telephone number. They've also baked in resources as well that they don't then tell you to call. It's more concierge. It goes a little farther than they used to. So I would also encourage employers to look at who their EAP vendor is and analyze, do I have the vendor that's best in class for what I'm expecting, what I'm willing to pay, and the resource I want my employees to begin to receive.
And where do they start that conversation? So when I talk to a lot of employers about this topic and about EAPs, and they're always like, well, my EAP doesn't do this, my EAP doesn't do that. So my first question is, have you asked?
Yeah.
Like, did you go like,
did you know there's a buy-up option?
Did you say like, hey, I want this stuff, and see what they say? Because a lot of times the answer is like, oh yeah, we already provide that for you, and you just don't have the right flyer or whatever.
Right.
But other times it's, oh no, you need to go somewhere else to get that too. I mean, how are you guys seeing kind of that conversation initiating in different ways, or what's kind of the feedback you're giving when people come up to you about EAP?
I think EAP used to be just a value added that was maybe coming through your life and disability insurance company, and that still can be very true.
Yeah.
It's now becoming more of an imperative benefit that's holds higher regard, and so we're doing EAP analysis for people to say, well, does the current vendor you have now meet the need, and what are you expecting, and can we hold that vendor accountable and get more for the same price, or pay a little bit more and get way better service, or do we need to make a change? And so we're doing EAP focused analysis in a way we never have before, because the demand is up in a good way.
Right. And so, I mean, things like EAP, your health plans, co-pays, kind of all of those things factor into how you're supporting your employees. But I think when it comes to like the day in, day out of this, it's culture.
Yeah, it's about who
leadership.
who your leader is.
Right. And so, if you're a leader that's kind of, I mean, you've been running your business since the 80s or the 90s or the early 2000s, and you're just now, or even just in the last 3 or 4 years, you've been starting down this journey. To you, what are those key kind of culture touch points? What are those things that kind of 101 level, check some boxes of like, start doing?
Yeah, so the one thing I always encourage, the first thing I encourage people is to be vulnerable in a way that's comfortable, as we talked about before. The second thing I remind people to do is don't think you need to be a clinician unless you're a clinician.
Right.
Very few leaders are clinicians. So don't think you need to be a clinician. Don't get to the point where you're, well, I gotta go research that and diagnose what, major depressive disorder is. No, that there are clinicians in this world that's their job. So don't ever go past a point of comfort and into the clinical realm. But it's about vulnerability, and it's about simply being open and listening, being curious and being a good listener. There are formal ways that frontline leaders and business leaders can be more confident in this area without having to step across the clinician bridge. And the short answer is, the one I recommend is using mental health first aid.
Sure.
Mental health first aid is a formal program where a trainer comes in and trains frontline leaders on how to identify crisis in their workforce, and then be able to not be a clinician, but instead where to guide them to resource. Yeah. And they're like, well, if we train them in this, they're gonna feel accountable. Well, guess what? They're already accountable. If we train them in this, they're gonna feel like they have to do clinical stuff. No, that's literally the opposite of what this training is. Where to stop and then guide them to the right resources. So mental health first aid is another thing that I think is a big positive investment, and it's not very expensive. It's very inexpensive.
Yeah, so cheap plug there that I didn't pay Paul to do is we've been doing quarterly ones with all the local chambers. It costs local members only $5 to attend. Local
Crazy inexpensive.
And we've been doing that for 2 years. We have 2 more coming up, in 2023. We're hoping to continue that in the future. But the short of it is it teaches you how to like be engaged while not being a clinician.
Yes.
And also I feel like the main thing I've learned every time I've gone through those trainings is how to be how important it is to be proactive with vulnerability and support rather than reactive.
Yeah.
Because it's almost like if the worst thing you can do is somebody's like, oh man, like I'm having a really tough day today. And then if your response is, oh, me too, let me tell you about my tough day.
Right.
You're like actually diminishing their feelings instead of building them up. But if instead you as a leader come to people when you're having a tough day and say, I'm having a tough day, it makes them feel like they can also talk about it more. Sometimes the answer is just that sucks. Sometimes it's needs to be, hey, here's a resource. But I think that was where mental health first aid made a huge difference for me, and where I see it for other leaders is like, it helps you differentiate between those that sucks moments and just raw empathy in the right way, and the moments of like, oh, like, let me help you. Like, this is real how you're feeling and you need help. Let me help. And what that means to direct them to people that really are qualified to like provide that assistance.
And I think you use that other really important word. Just approach everything with a healthy dose of empathy. Like, for a second, put yourself in their shoes. It's really that simple. So a little bit of vulnerability and a ton of empathy makes everything better from a cultural perspective, so that we're places. Here's what I always say. Every single one of us has emotional well-being. Some of us, you and I, are lucky enough to also have a mental health diagnosis, but everybody has emotional well-being, and they're somewhere on that journey.
Yeah.
And it ebbs, it's seasonal, it ebbs and flows, it's situational. And so if we just walk around with a little bit of empathy, it's going to be a lot better for the people we lead and work with.
Yeah, because it's okay to have a tough day.
Yeah, it's okay not to be okay.
It's okay not to be okay. Yeah, we all have that. So, you know, how do people get a hold of you guys? What's the best way for them to connect? You know, and to learn more about what you guys do and how that you can support.
Yeah, absolutely. So for me personally, I think one of the best places to find me is on Twitter. If it's still going to be living, I don't know. We're not sure
X or whatever.
Yeah, it's whatever it is. But at PE Ashley. You can find me there. I'm pretty active. Certainly LinkedIn would be a place to find me. My email address is paul.ashley@nfp.com. nfp.com is a great website resource to connect with NFP. So, you know, those are ways that people can reach out to me and, you know, find me. I'm pretty open.
I love it. And I will say, like, you guys have always been super easy to engage with. Yeah. In general, I've found benefits advisors here in the state of Indiana are all having this conversation. They're all super engaged. But if you want to start asking questions of even how to ask the right questions, we're also here for you. And my contact information is all over this website, and the list of services we provide are as well. And every single day, we're going to keep working harder to work with good partners, make Hamilton County a great place to live and a great place to work, and do everything we can to just kind of move this journey forward. So thank you for joining us. Hopefully you found this helpful. Dive into the other resources on this site. They're really good, and they can help you begin this well-being journey and this employee assistance journey, both being proactive and reactive to mental health and well-being within your workplace. So thank you, Paul, for joining today.
Pleasure.
And I hope you are beginning this journey or continuing it from a well place. Thank you.